52-year-old male with previous lumbar fusion, L5-S1 with titanium interbody cages, presents with severe bilateral sacroiliac joint degeneration. The area circled in black on the inlet view of the SI joint shows screws that have to be at least 45-50 millimeter length to adequately transfix the SI joint and achieve stability. Patient underwent a bilateral PML SI joint fusion after failing conservative treatments and obtained about 85% to 90% improvement of pain after surgery. The AP view show bilateral SI joint fusion with 4 3D printed screws going from posterior medial to lateral trajectory, transfixing the SI joint. To learn more about the PML SI fusion or more, check out our website at www.learnpml.com.